Hello YouTube, welcome to my channel. In this tutorial, I will be discussing with you case history from the Department of Obstetrics and Gynecology. Now, I encourage you to pay particular attention because these are high yield cases. So on the screen right now, this slide is just listing the topics that that will appear in the cases. So the first case, let's begin. A 28-year-old appeared to the clinic with complaints of abdominal pain, which appeared suddenly during physical work. Patient happens to have malaise and weakness. Upon collecting history, menstruation started at 17 years old and it was scanty and painful. The patient is not pregnant, and on gynecological exam, the vagina and the cervix are intact. The uterus is small with limited mobility. To the left and behind the uterus, you can determine a formation of sizes 6 times 8 centimeters with a bumpy surface that is mobile and painful. The right appendages are not defined. Diagnosis and tactic. Alright, so I'll give you a few seconds to think about it before I show the answer, and then we can go on from there. Right, so the correct answer is ovarian cystostion. And for management, we have to send to OT for cystectomy and express histology to rule out cancer. Right, so a 26-year-old gestational age according to the last menstrual period of 10 to 11 weeks. On ultrasound, the results reveal that the uterine body corresponds to 8 to 9 weeks of pregnancy. In the uterine cavity, there's a defined ovum that is irregular, that has irregular contours, and the embryo is unclear. The heartbeat of the embryo is not determined, is rather not defined. Diagnosis and tactic. Okay, so I'll give you that 5 seconds to think about it. Right, very quickly for this one, it's very easy. This is a missed pregnancy, and important investigations to conduct hemoglobin levels. We need to do a group and save test in case we plan for future blood transfusions. We also need to do a bedside clotting test, and further on in management, we need to induce labor by giving misoprostol, which can be vaginal or sublingual, after which we need to do a manual vacuum aspiration. Alright, so here's another case. A 30-year-old multiparous woman was admitted to the maternity ward in a serious state of acute anemia. Upon investigations, she's 36 weeks pregnant. Contractions are rare. The uterus is tense and painful. There is absent fetal heart sounds. Per vaginal examination, the cervix allows only one finger. The head is descended and there is no placental tissue. What's your diagnosis and tactic? I'll give you some time to think about that. In this case, this patient is having placenta abruptio, an emergency obstetric condition in which there is a possibility of fetal death, and the tactic is C-section, emergency C-section. Right, so here's another interesting one. 15 minutes after the delivery of the placenta, which was whole when examined, there was bleeding on the mother. The uterus is flabby. The mother is weak and pale. Pulse is 100 beats per minute. Blood pressure is 90/60 millimeters mercury. What's your diagnosis and tactic? Okay, so join me in part 2 as I discuss the management and approach to this case. If you're new, kindly subscribe, and don't forget to share this channel on this video.